welcome back. Ted, watching Free Speech TV in Soledad, California. Hey, Ted, you're on the air with Alex. What's up?
Hi. Yeah, very interesting. I really like your show, Tom. I am in my 70s, and I have both Medicare and a supplemental that was part of my union. You know, when I was working, the union negotiated a system where it would continue as a supplemental in my retirement, and this worked really good. Well, I've had some very expensive cancer treatment that's probably saving my life right now. My question is, my wife worked as a caregiver. She didn't have anyway, she has Medicare, but she doesn't have any kind of supplement. And I get lots of ads, which, you know, the insurance companies that Tom rants against in terms of their greediness. How can I research what would be good if she needs a supplemental insurance, and which ones are ethically pretty reasonable? And I have a related question about the ACA. Trump and Ryan and McConnell and all their puppets come on and rant about how horrible the ACA is and how it's destroyed America and all this other BS. Anyway, how do I find out real information about the problems of the ACA so I can talk to the Fox brains? Because they really think this is awful, and I know the ACA is helping a lot of people. So, how do I research this stuff? That's my question, and I'll shut up.
Great questions, and very difficult. Finding good information, especially around Medicare and supplementals, is very difficult.
Is that because there's so many corporations that are making money off it?
Because this is a billion-dollar industry. There shouldn't be any holes in Medicare that need supplemental insurance, and the insurance companies are super greedy, as you bring up all the time. But there is a gap, and most people find at some point a need to fill that gap. And, you know, AARP is a giant insurance company that does offer a product aimed at filling.
Well, they have a couple of products.
Yes.
You've got the Medigap, which fills in the hole, or you got Medicare Advantage, which replaces Medicare essentially for the year.
Right.
But I looked around, and it didn't look to me like AARP's stuff was the best. I mean, I ended up with another company that I don't want to name on the air, but there's some good companies out there.
There are good companies out there, and you actually just have to research it like you do insurance, which is very difficult because they don't like to give out all of the information, and they like to use flash marketing that, kind of like AARP's funds their whole thing by marketing one insurance product.
Right.
And I'm not
Healthcare.
Exactly. It's United Healthcare. I'm not saying that is the good one. I'm saying that's what they actually do. So it is difficult. There's a site called Just Care, which is justcareusa.org. It's run by Diane Archer, who founded the Medicare Rights Center. Social Security Works does work with Just Care, but the entire purpose of that website is that there is no profit motive in this. It is actually just to go through and try to get as much.
What's the website again?
Justcareusa.org. And that is a good starting point.
That's a great resource. Justcareusa.org. James in Palm Coast, Florida. Hey, James, you're on the air with Alex.
Hi. It's good that you're talking about Social Security and Medicare. And I have a problem. I'm 79 years old, and I've always been a member of Social Security since I was able to. But I'm wondering is why does we talk about the cap, and the cap has to be removed, and I agree with that. The cap has to be removed on Social Security. And I'm going to take your answer off the air if that's all right with you. But I would like to ask and continue with my question. Why does a wealthy man or wealthy people like the Koch brothers or President Trump, why do they belong to the Social Security system and to Medicare? I assume that they have enough money to pay for their own hospitalization, but I'm wondering why they belong to the system.
That question opens a very slippery slope, James. Alex?
It's a really great question, though. But what I want to say is they should be in the system. The universality of Social Security is one of the things that protects it the most. But what they shouldn't get away with is not paying into Social Security on all of their income, just like the rest of us. Right. So there's no law that says you have to take your Social Security benefits or keep them. You can donate them back to the Treasury, right? Like if a rich person doesn't need, Warren Buffett can donate it right back to the Treasury. But we don't want to exclude anyone based on how much money they have or anything from the system, because we want everyone to pay into the system. Right. We want as close to universal as possible. Right.
Once you've mean tested it, you've turned it into a welfare program, and there's nothing easier for Paul Ryan and his Republican buddies to destroy than a welfare program. So, that's, yeah. Elizabeth in Wheeler, Michigan. Elizabeth, you're on the air with Alex.
Hey, hi, Tom. Oh, I'm in Farmington Hills. But
okay,
anyways,
great. I know right where you are. So what's up?
Oh, yeah. Thanks for taking my call. And Alex, thanks for being there. My question is, can a person start drawing their Social Security at 62 and continue to work? And if they continue to work, does that continue as credits towards their benefit of Social Security?
So that's a great question, and it's actually quite complicated answer. But because I want to get to the most important part first, which is the earliest age that you can take your Social Security benefits is 62. But for every year that you take your benefit before the full retirement age, which it changes for anyone my age, I'm 36, it's 67.
Right, and for my age, it's 66.
Right, and so any 1 year before your full retirement age is an 8% reduction of your benefit forever, right? Forever. So there's no going back from that. So the reason I bring that up first is
wait as long as possible.
Exactly, because it'd be very difficult that the continuing, because the money does count, it's still your wages, but it'd be very difficult to see a situation where you would be earning enough that it made up for that 8% reduction.
Right. Plus,
forever.
Because of Reagan's reforms, your Social Security revenue is taxable.
It is.
So if you have any kind of income at all, and then you take Social Security on top of that, you're probably just jacking yourself up into a higher tax bracket and giving a lot of that Social Security money back to the IRS.
Exactly. Or you look at it as just lowering your benefit. And right. I mean, it's the same thing.
Right. So wait as long as possible is the
generally it is it is based on everyone's own health and et cetera, but there is usually a right answer. Go to your local Social Security office, spend some time with this. Look at your income, your assets, see how long you can go without taking before you take your benefits, because it's not just year, every month that you delay, it actually increases. So it's a monthly thing.
That's amazing. Okay, Jenny in American Falls, Idaho. Jenny, you're on the air with Alex.
Hi, thank you. Alex, I am disabled and housebound, and I don't have a computer, so I really appreciate your information to us. I would like to revisit the idea of removing the cap for the FICA, because I understand that it's set pretty low, and we should, I think we could probably keep Medicare, keep Medicaid, keep Social Security very healthy if we just didn't have a cap on that. And I also wanted to know the feasibility of that. Plus, I think that money in the stock market on Wall Street should be taxed at a minute amount of percentage per share and not transaction, because, as the pension plans go, workers put in a little like $50 a week from their paycheck, so that taxes the lower income and middle income people and not the big.
Right. Jenny, we're running out of time here. We got about a minute and a half, so let's get Alex in to answer your question.
And those are your callers are fantastic, because
as always,
exactly,
we have the best callers in the world.
You
Alex.
do. She just hit on everything, right? Yeah. Like, yes, the cap is far too low, $127,000. So the people above it, though, it's a very small percentage. Less than 2% of Americans are not paying in on all of their income. So scrap the cap, get everybody paying in on all of their income, including their investment income, And we can not only extend the solvency of Social Security, we can expand benefits for everyone. The only problem with Social Security is that for millions of people, benefits are too low. Now, if we get to the second half and we have a financial transactions tax, dedicate that to Social Security and we can expand benefits even more. Dedicate that to Medicare and we can expand Medicare. And that is just a tax on Wall Street speculation, which is bad for the economy anyways. So that is a very good proposal that has been implemented in other countries, and we've seen that it works. The thing that I like about this discussion is when you dedicate that tax, when you dedicate it to Social Security and or Medicare, you know that it's coming back to the people. And that's why I propose always to dedicate it to Social Security or dedicate it to Medicare.
Sounds like a plan. Alex Lawson, the website, socialsecurityworks.org. And what was that other site that you recommended?
JustCareUSA.org.
JustCareUSA.org.
And you can get to it from Social Security Works.
Okay, so go to socialsecurityworks.org and you can find it. And you can tweet him at ALaw202 or at SSWorks. Alex, thanks so much.
Thanks, Tom.
Great having you.